Have you recently been intimate with a partner and now find yourself with a nagging question, a feeling of uncertainty about your sexual health? It is a common and valid concern, and addressing it directly is the best step. Yes, if your partner has an STD, or sexually transmitted disease, it is highly probable that you were exposed. The primary way STDs are transmitted is through sexual contact, meaning if you engaged in any form of sexual activity with an infected partner, you would have come into contact with the pathogen. This makes prompt testing and understanding your status critically important. The core mechanism of STD transmission involves the exchange of bodily fluids like semen, vaginal secretions, or blood, or through skin-to-skin contact with infected areas. This can happen during vaginal, anal, or oral sex. What makes STDs particularly tricky is that many people, including your partner, might not show any obvious symptoms, or their symptoms could be very mild and easily missed. This is why a lack of visible signs does not rule out the presence of an infection, both in your partner and potentially in you. If you believe you have been exposed, there are clear, proactive steps you should take. First, if you haven't already, have an open and honest conversation with your partner about their STD diagnosis. Next, schedule an appointment with your healthcare provider as soon as possible. Clearly explain your situation, mentioning that you were exposed to an STD and naming the specific infection if you know it. While waiting for your appointment and test results, it is wise to abstain from any sexual activity or consistently use barrier methods, like condoms, to prevent any potential further transmission. Understanding the concept of a window period is also vital for accurate testing. This is the time between potential exposure and when an STD will actually show up on a test. For example, some STDs like chlamydia and gonorrhea can be detected within days, while others, like HIV, might take several weeks to show a positive result. Your doctor will advise you on the appropriate time to test based on the specific STD and your last exposure, potentially recommending follow-up testing if you are tested too early. Early detection allows for prompt and effective treatment, preventing more serious health complications and stopping further spread. Taking immediate action by getting tested and communicating openly is the most effective way to safeguard your health and gain peace of mind. It allows you to confirm your status, receive necessary treatment, and take responsible steps towards maintaining your overall sexual well-being, both for yourself and for any future partners.